Good morning, and thank you for joining us. My name is Tasneem Hussain, and in this presentation, we'll be talking about complying with establishment registration requirements. At the end of this presentation, you should be able to describe the establishment registration requirements under 21 CFR 207. You should be able to identify some common registration-related issues. You should be able to explain the compliance program and the important points in the deficiency letter we sent to the firms, and then be able to describe some effects of non-compliance. So before we can talk about compliance with respect to registration data, we have to briefly go over the requirements themselves. Registration requirements are found under Section 510 of the FD&C Act and easier to find and codified under 21 CFR Part 207 Subpart B. So in the next few slides, we'll go over a few sections for who must register, what info must be included, when to initially register, and when to update. So starting with 207.17, this has who must register. This means all domestic and foreign firms who perform any manufacturing activity. Private label distributors do not perform any manufacturing activity, so they are not required to register, and therefore they should not register, while contract manufacturers do manufacture, and thus they must register. Under 207.21 is when to submit the initial information. Domestic manufacturers must submit no later than 5 calendar days after beginning to manufacture, and foreign manufacturers must do the registration before importation. 207.25 has what information must be submitted. It includes identifying information such as the name or owner or operator of each establishment, the name of the establishment, the address, phone number, contact information, registration information, the unique facility identifier, the business operations, names and address of official contact for the establishment. So also under 207.25, foreign manufacturers must include the name, address, telephone number, and email for their U.S. agent, and for each importer in the United States, and information about each person who imports or offers to import. And FDA communicates with foreign establishments via the U.S. agent. Thus, having an updated and current information is vital for communication. 207.29 has the requirements for updating the registration information. So you may be aware already that between October 1 to December 31 annually, the registration must be renewed. And then if there's a closing or selling of an establishment, if any changes have been made to the establishment name or address, or any change made to the official contact or U.S. agent information, this information must also be sent to FDA within 30 days of a change. If there are no changes, a no change notification may be used to update the requirements, and all the changes that have been made since the last annual update must be reflected in the new information. If no information has been updated, then they can certify that no changes have occurred. So where is the registration data found? Drug Establishment Current Registration Site, or DECRS. This is the FDA's online registration database, and if a firm registers properly with FDA, the data will be found here. If the data is not found in the site, it means that the firm has deregistered, or the registration has expired, or the data may have been inactivated because of a compliance case. Here we have some common issues that we encounter with registration data. Some facilities register when they should not register, such as, for example, PLDs that we talked about earlier. Sometimes there are DUNS number issues, and sometimes there are missing FEI numbers. Some firms will enter an incomplete or incorrect business operations. Many times we see unauthorized U.S. agents who are submitting data to FDA. This can lead to many issues. Having outdated contact registrant information is very problematic. Obviously, having incorrect contact information means it's hard for FDA to reach your firm, and the firm will not get timely communications. And then FDA, this may lead FDA to compliance actions against your firm. So it's very important to have updated contact information. So now we can get into the compliance part and talk about our compliance program. The program started in 2015 with the mission to protect and promote public health by striving to achieve accuracy and integrity of the establishment registration and drug listing data. We do this in several phases. So we review the data for any kind of inaccuracies or errors. And if we find errors, we send a deficiency letter to inform the firm and give them 30 days to make the corrections and resubmit. If they don't comply with that simple steps, then we have to move forward with something harder, which is, removing the data from the Decker site. And if the firm still does not address the issue, then we may inactivate the registration data. And then we may also go forward with registration warning letters to the firm. Let's discuss a little bit more about the compliance program and the deficiency letter that's important and that we send to the firm. These are some highlights of the deficiency letter that we want to point out. In the first part of the letter, usually there is a statement of the deficiency in the first paragraph. And then the next point to note is that the firm is given 30 days for making corrections. And then another point that's very important is that non-delivery of the letter does not stop the process, meaning that if the firm does not receive our letter, it does not relieve the firm from the registration requirements. And it's not just that. It's an actual requirement under 207.29A3. The registrants must update any changes to contact information within 30 calendar days of the change. So again, please read all the instructions on the right steps to follow for resubmitting and updating your files. And so why is registration data important? It's important because it helps FDA have an inventory of all drug manufacturers who are producing drugs for sale in the U.S. It aids in the inspection program. It assists with drug shortage cases. It's important for post-market surveillance and adverse event reports, and it's also required for drug import and export. And now we can talk about some effects of non-compliance. So having outdated contact information of the registrant and establishment, this will only cause delays because the firm will not receive timely FDA communications and notifications. If there are any DUNS issues, this can create validation errors and then will stop the submission from going through. Incorrect or incomplete data can lead to compliance cases. Unresolved compliance cases if the registration data has not been fixed, then the data will be removed from Deckers. Here are a few more effects of non-compliance that may be a little more serious. So if you use an incorrect manufacturer or if you use an expired establishment as the manufacturer in a drug listing submission, then that listing is misbranded under Section 5020 of the FD&C Act for including such unregistered or expired establishments. And further, if this drug is introduced in the U.S. commercial distribution, this is a prohibited act under Section 301A of the FD&C Act. Please note that drugs which appear to be misbranded may be refused entry at a U.S. port. And if an establishment warning letter is issued, this can stay in a permanent record against the firm. So we have come to our first challenge question. Under which subpart of 207 are registration requirements found? We'll give you a few moments to think of the answer. The correct answer is subpart B. Subpart B has the registration requirements. Our challenge question number 2. All of the following are true about establishment registration requirements except A. Establishment registration must be updated annually between October 1 and December 31. B. Foreign establishments must register initially within 5 days of beginning to manufacture. C. Foreign manufacturers must include a U.S. agent and important information. D. A no changes notification SPL may be used to renew the registration information. And here we'll give you another few seconds to think of the answer. So statement B is false. Domestic establishments must register initially within 5 days of beginning to manufacture. Foreign establishments have to register before their drugs are offered for import into the United States. And our final challenge question number 3. What are some negative effects of not complying with registration requirements? A. Firm may receive a deficiency letter. B. Data may be removed from the Deckers site. C. Inclusion of incorrect manufacturer may lead to misbranding charges for drug. D. All of the above. And we'll give you a few moments to think of the answer. The correct answer is D. All of these are possible negative effects of non-compliance. So as a summary of what we talked about, please review and follow the registration requirements under 207. We have some links coming up for you. Our compliance program helps to keep submitted data accurate and complete. An establishment registration must remain current as it can affect listing data too. And failing to comply can lead to some unwanted negative effects. So here's a closing thought. Compliance with registration requirements can be easy if you follow the regulations and submit your information correctly the first time. And here are the resources. The Electronic Code of Federal Regulations 21 CFR Part 207, the Drug Establishment Current Registration Site, and the Electronic Registration and Listing Compliance Program. Thank you for your time and attendance today, and if you have any questions, please let us know.